Hi, my name is Pallavi Prasad, and for the past few days, news along the lines of India's second wave has peaked is doing the rounds. On Monday, new cases dropped below 3 lakh for the first time since April 21st. And in the past week, India has registered a 13% decrease in new Covid-19 cases. If the headlines you are reading are saying the worst is behind us, I'd urge you to pause and listen on. One reason for the apparent decline: most of India is under a lockdown. All of India, except 6 states and UTs, were under a complete lockdown as of yesterday. That curbs transmission. But there are 3 other factors to look at when assessing where the pandemic is or going: new cases, test positivity rate, and R value. Let's start with new cases. They have decreased over the last 7 days nationally and in some of the worst hit states like Maharashtra, Delhi, UP, MP, Bihar, and Chhattisgarh. But cases are increasing in 6 other states, 5 of them in the northeast. A lakh cases per day nationally is still substantial. It means the virus is very much still out there and finding carriers to spread further. This is even as testing has decreased in many states, and so new cases have decreased. The Hindu reports 11 major states have reduced testing, including Karnataka. Mumbai, cited as an example of how a city can bring Covid-19 under control, was conducting an average of 50,000 tests per day in mid-April. They have now come down to an average of 20,000 to 25,000 daily, with nearly 40% of them being rapid antigen tests and not the more accurate, more sensitive RT-PCR tests. We also know that Covid-19 is now spreading in northeast India, as I just mentioned, rural towns and villages where about 2/3 of India lives, tribal areas. At least 49 members of the particularly vulnerable tribal groups in Orissa have tested positive. Many of these areas have significantly smaller testing capacities, fewer hospitals, technicians, healthcare staff, and far off diagnostic labs, and that's an understatement. Compared to urban India, there is also less awareness and resources among people to go to a healthcare center and get tested for Covid-19. So the declining number of new cases you see is not the whole picture. Reduced and inadequate testing can create artificial peaks, which experts say is likely what we are seeing in India now. Next, let's talk about positivity rate. It is the percentage of people who test positive for the virus of those who have been tested overall. A positivity rate of below 10% is hopeful news. For the first time in 13 weeks, India's positivity rate has declined, but still stands at 13.3%, which experts, including WHO Soumya Swaminathan, say is precariously high given that we are not testing enough. Positivity rates have decreased in 26 states, largely attributed to lockdowns, but are still above the 10% mark in most cases. Sikkim has a high test positivity rate of 26.7%. In fact, 22 states have more than 15% case test positivity as of yesterday. This includes Lakshadweep, Puducherry, Goa, West Bengal, and Karnataka, which have a test positivity rate of over 30%. Many of these states have a high test positivity rate while testing has reduced, which means that the infection is likely spreading fast and going undetected. So the decline in positivity rate is not all rosy yet. The third factor to look at is R value. It is the estimated number of people that an already infected person can infect on average. When the R value falls below 1, it is generally seen as an indication of the epidemic having peaked. Since May 11, India's R value has fallen below 1. Most large states have also shown a reduction in R value. But despite a reduction, states like Tamil Nadu, Karnataka, Uttarakhand, Kerala, Punjab, West Bengal, and Orissa, they all have an R value above 1. Now, if all of this number crunching sounds like I'm being a Grinch at a time when there seems to be a slight glimmer of hope after weeks, that's not my intention. There is a visible improvement in places like Delhi and Mumbai, but it is too soon to even think about lowering our guards. These trends need to continue like this for weeks before we can breathe easier. Also, we need to have a confluence of all three factors: new cases, positivity rate, and R value declining for weeks in several other worst hit states. Just yesterday, we reported the highest ever death toll in 24 hours for any country in the world since the pandemic began. Less than 3% of India is vaccinated, which is our best shot at beating this pandemic. So we have miles to go before we can call it, or any other headline for that matter. So stay at home, wear your masks, wash your hands, maintain distance, and get vaccinated as soon as you can. I'll stop here for today. If you've been listening, thank you so much for your time.